भारत की प्रतिभा को सलामी देते हुए इंडिया बुक ऑफ रिकॉर्ड्स के हीरो संस्करण में आज हम चलेंगे मुंबई, महाराष्ट्र, जहां एक डॉक्टर ने बाइलेटरल नी रिप्लेसमेंट सर्जरी के द्वारा बनाया एक अनोखा कीर्तिमान।
In the world of orthopedic medicine, every breakthrough begins with a challenge. For patients suffering from severe knee pain, even a few steps can feel impossible. But sometimes a single surgery can redefine what doctors believe is possible. On November 21, 2025, at Safee Hospital, a remarkable medical milestone took place quietly. At the center of this achievement was Dr. Amyn Rajani, an orthopedic specialist. Known for his expertise in joint replacement, arthroscopy, and sports injury treatment, Dr. Amyn has spent years helping patients regain mobility and independence. But this case was unlike any other. The patient, a 52-year-old man weighing 128.85 kilograms, was suffering from severe knee degeneration. His weight and joint condition had made mobility extremely painful, and this increased the complexity and risk associated with surgery. Traditional total knee replacement would normally be considered. However, in this case, Dr. Amyn chose a different approach: partial bilateral knee replacement, a procedure that replaces only the damaged portion of the knee joint while preserving healthy bone and tissue. In the operation theatre, every detail mattered. The surgical team worked with meticulous focus as Dr. Amyn carefully removed the damaged cartilage and bone from the knee. The goal was not just replacement but restoration. This procedure later set a record for conducting a partial bilateral knee replacement surgery on the heaviest patient, marking a significant milestone in orthopedic surgery. The achievement was officially recognized by the India Book of Records, highlighting the possibilities of advanced surgical techniques when combined with experience and innovation. Now let's connect with Dr. Amyn Rajani himself to know more about his journey so far. What is the difference between knee replacement surgery versus this partial bilateral knee surgery?
Knee replacement surgery has been there since many years, and so has partial knee replacement. Now, the difference between the two is that when we do a total knee replacement, we change all the compartments of the knee. The knee is made up of 3 compartments: the inner compartment, the outer compartment, and the top compartment, each comprising about 33% of the knee. So 33, and 33, that is about 99 to 100% of the knee. When we do a total knee replacement, we change all the compartments, we remove the ligaments, we do some releases of the inner ligament, we remove the menisci of both the compartments, which are not mandatory in all patients, because most of the patients that we see have disease only in the inner compartment. So what this partial knee replacement does is that it changes the surface only of the inner compartment, that is 33% of the knee, and the remaining 70% of the knee, along with the ligaments and the menisci of the other compartment, they are retained because they are normal, natural, and God-given.
As a doctor, feel after doing such, I would say, beautiful surgeries?
Thank you. So God has been kind. There's a lot of positivity in our practice. We really care for our patients. We really, in fact, have a lot of empathy for our patients. Not just me, but my entire team, my support staff, the hospitals that I work in, the nursing staff. It is not just about surgery. I am a very conservative surgeon. I don't operate unless and until actually when the patient demands for it. So I don't sell a surgery. I will do it only when the patient really, wants it and begs for it. It's been a good journey so far. We've got many awards. We've published a lot of international literature. We've also been, before this in 2014, I was also nominated in Limca Book of Records for operating the oldest patient for a total knee replacement surgery in India. That was 98 years old. So, so 98 was, nobody's done a total knee replacement, and that record has not been broken yet, I believe. So, God has been kind, and we've been doing ethical and positive practice, and that is helping us.
we would like to know what kind of a person is Dr. Amyn, your hobbies, your interests, what do you do before the surgery, after a surgery? It must be very heavy. So what do you do?
As I said, I'm more of a conservative surgeon. I operate regularly, but I don't do lot of surgeries. I do surgeries only for patients who require them. So I'm not a busy surgeon. I have a lot of free time. I balance my life, and I feel that I give justice to my patients. I see about 15 to 20 odd patients in my clinic every day, and I operate about 1 or 2 cases a day. So my evenings are free for myself, where I spend time with my lovely daughters and my wife, and I balance my life because to be a good doctor, you need to have balance rather than numbers, and I firmly believe in that.
Wonderful.
When I get up next morning, I am fresh to give justice to my patients because I've had a good evening or a good night, and when I'm in my clinic, I'm giving enough time to each and every patient so that I'm fresh in my mind and they are satisfied with my freshness.
Performing surgery on such a heavy patient required exceptional surgical planning and expertise. Thanks to Dr. Amyn, whose dedication and expertise made this possible. One surgery became more than a medical achievement. It became a doorway to a new life. Dr. Amyn has made headlines in the media for his remarkable achievements. With skill, vision, and unwavering dedication, Dr. Amyn Rajani has not only set records but also transformed lives.